he has conjunctivitis, and he has cervical lymphadenopathy. No, these are too big for sarcoidosis. My God, sir, I don't know what that is. But this boy, this boy had vaginous granulomatosis. He was started on cyclophosphamide with steroids, and these lesions completely disappeared. Completely disappeared. Okay. Young female, a known case of systemic lupus erythematosus, has come with some problem in the hand. Maybe some trainees would like to comment. She has been asked to open her hand and stretch her fingers. This hand is normal. There is hypothenar wasting and inability to stretch these fingers. So she has ulnar neuropathy. And in a patient with a known case of systemic vasculitic disease, mononeuritis multiplex. This is a neuritis which is produced by vasculitis. How is it produced? The vasculitis causes thrombosis and infarction of the nerve fibers. Right?
What's happening at the tip of
No, I think this was just a pigment change. This is not terminal. This is not terminal. And this lady had mononeuritis multiplex, but we will not be able to call it multiplex if this was just one nerve, but the presentation is that. Okay, young male comes to the clinic, says कि जब मैं काम करता हूँ with my left hand, it starts to hurt very quickly, and then I get very tired. I've also been running low-grade fever, and if you do a ESR, the ESR might be elevated, and you measure the blood pressure in the two arms, and you find that the blood pressure in the left arm is very low as compared to the right. The diagnosis? You don't see the subclavian artery on this side. Sorry? Okay, we'll talk about the Steele syndrome in a moment. There is obliteration of the base of the vessels here, and all these are collateral channels in an attempt to supply blood to the limb on that side. So this is Takayasu arthritis. Young females of Japanese origin, that's where it was first diagnosed, but we see it very commonly. Well, not commonly, but we also see it in our male patients. Now, the subclavian Steele syndrome, which Dr. Samina is talking about, is a unique phenomena in which, due to subclavian stenosis, but usually a preductal stenosis, the subclavian artery, as it arises, the first branch that it gives is the vertebral artery. The second branch that it gives is the internal thoracic artery. Then it proceeds as the subclavian artery. If there is compromise of the subclavian artery and the limb causes vasodilatation, which is seen after exercise, then there is a retrograde flow from the vertebral artery into the subclavian. And when that happens, the patient suddenly becomes presyncope and may have a syncope. So subclavian Steele syndrome, sorry sir, अगर आपको कहीं जाना हो तो you are most welcome. Okay, or do you want me to finish quickly? Okay, I'll finish quickly. Sorry. Okay, this is subclavian stenosis in Takayasu arthritis. This is a young male with peripheral pregangrenous changes due to vasculitis.